everybody. For those of you who are just joining, I am Dr. Mary Claire Haver. I have a few minutes before I have to go back and get ready. I'm actually on vacation with my family in Kenya, and we are going on a game drive. We're on a safari kind of trip, but I wanted to come on live. I've gotten so many questions recently, so I wanted to come on live for a Q&A for those of you who had questions. So I know in the US it's a little early in the morning, so if you're just joining me, drop your Q&A. There's an interact button on my phone. It's right here with any questions that you might have. So one of the most common questions that I get, or frustrations that I get from people who reach out to me, is, hey, I went to my doctor with X, Y, and Z symptom, and they think that I am too young for menopause. So let me do the math for you here. The average age of menopause is 51. Okay, that's just average. So if you look at the normal curve, meaning where about 90% of people fall, is between 45 and 55 years of age. Okay, with average being 51. However, perimenopause is the beginning of the decline of the estrogen production from your ovaries, and that can begin 7 to 10 years before your period stops. So it is completely reasonable for a 35-year-old woman to be having menopausal symptoms. So if you're just joining me, everybody double tap my face. Just take your finger and go tap, tap, tap on my face like this to like this video. It helps drive engagement. TikTok asks me to ask you to do this every now and then. You can also share this video with the interact button. And if you have any questions, I am happy to answer to the best of my ability. Just drop them in the Q&A and the interact button below. Or drop them in the comments, and I will be happy to answer them. So yes, I'm on a family vacation. We are in Kenya, which is the most incredible country in the world. We are having the time of our lives. These people are so gracious and wonderful. We are staying in the Masamara Conservatory, which is a huge game park. They do not allow game hunting here. They haven't since the 70s, so all the animals are protected. We are here. Okay, so I'm looking at your questions. So go ahead and drop your questions. Let's see. Drop your questions in the question marks down below. I am doing fine. I've got a few minutes before we leave for our game drive. Your gen won't take hormone levels. That is a great question. So very common frustration that I get from patients is that their gynecologist will not check their hormone levels. And I'll tell you why. We do not have a good blood test to determine if you're in perimenopause. We check blood levels to confirm that you are post-menopausal, meaning that your ovary function has shut down. We have great blood tests for that. But because our estrogen levels fluctuate so wildly in the perimenopause, it is impossible to have a blood test to determine if you're perimenopausal. The diagnosis of perimenopause is made by listening to the patient, listening to her symptoms, ruling out other causes like lupus, autoimmune disease, hypothyroidism, etc., doing those blood tests, and then coming to the conclusion that most likely the constellation of symptoms that you are having are due to menopause, and then going from there. Okay, I'm reading the question. So if you have questions, drop them in the interact button down here below for the Q&A so that I can post them. So is 20,000 units of vitamin D3 a day for 3 weeks too much? More than likely you will become toxic on that dose. Unless a prescription was specifically given to you, 20,000 a day would be considered to be a toxic level. So I would call your physician to make sure that that is actually, what you're supposed to be doing. If you are deficient, so typically for vitamin D, somewhere between 2,000 to 5,000 a day is for maintenance, just maintenance if you're doing a supplement. And if people are deficient, they do typically 50,000 a week as well as a maintenance dose. But 20,000 a day is going to be a lot of vitamin D, and you need to be monitored very, very closely. Okay, I'm looking at the questions. So remember, drop them in the interact button for the Q&As down below, any menopausal questions that you have. Thoughts on collagen peptide powder? I'm a big fan. I actually, this is what I'm drinking right now. It's a combination. So I'm in Kenya on vacation, but I packed my fiber and collagen powder with it. started using a specific kind of collagen called Verisol, Verisol. You can go to PubMed and look up the research studies, but it's good for cellulite and wrinkle appearances. It like stimulates collagen production. So I started it for that. I actually sell the brand now. I've partnered with Sparkle, who does the collagen. So we package it, we label it ourselves, but you can buy it directly from them. I really don't care. Now there's new studies showing that it's actually helpful for osteoporosis in menopausal women as well. So that's pretty exciting. So I'm a big fan. I know there's a few famous TikTok docs out there who are just, poo-pooing collagen, but I'm telling you, the research is there. The studies are there. It's a very nice source of protein for me as well. Because don't eat a huge amount of meat. I am an omnivore, but I'm always kind of fighting to make sure I get enough protein. And so taking the collagen supplement also ensures that I'm getting protein, because 1 scoop of the collagen is 5 grams of protein. I'm reading the questions. How can you separate symptoms of postmenopausal and autoimmune disease symptoms, Hashimoto's? That's a good question. So 1, get your levels checked. If you have autoimmune disease and Hashimoto's, see where you are as far as that's concerned with your endocrinologist. And then if you notice, what we see is that all autoimmune disease gets worse in perimenopause and menopause. It can. So that could definitely be the withdrawal of estrogen. Estrogen is actually a powerful anti-inflammatory hormone. So when it starts dropping, we see a lot of inflammatory diseases related. So if you're just joining me, I am Dr. Mary Claire Haver. I'm a board certified obstetrician gynecologist. I'm Dr. Mary Claire on TikTok, and please follow me if you don't. TikTok asks for me periodically to stop and ask for likes so I can stay relevant on this platform. So just double tap your screen, just tap on my face a couple of times. That gives me some likes. You can do super likes, where you just tap to the little heart across my face goes, and you send gifts and presents. I really appreciate it. But again, it is a struggle to stay relevant on this platform with all the dancing naked teenagers out there and a menopausal mom talking about thoughts on evening primrose oil. Okay. Thoughts on evening primrose oil. There are some limited studies that show it does have some anti-inflammatory properties. So there's some limited benefit. Thank you for the likes, guys. I so appreciate it. It's so helpful. Is there a good supplement that helps with menopause? There are a few that can be helpful. It depends on what symptom that you're treating, okay? Nothing is going to make your estrogen levels increase. Once your ovaries start declining, they decline, okay? You can make the estrogen you do have work more efficiently, and you can alleviate some of the symptoms with the phytoestrogens, the estrogen-like compounds, like soy and black cohosh can be helpful. Some women get relief from ashwagandha. Others get relief from other soy-based products. But nothing has been proven consistently to work for everyone. You kind of have to experiment if you're not willing. But I'm telling you, if whoever needs to hear this, every single one of you deserves a full conversation about perimenopause, what to expect, what your treatment options are, and what the risks are associated with choosing not to have treatment. And so if anybody has had good luck with a supplement, just drop it in the comments below. Again, most of these products, are basically not going to be harmful. They could interact with other medications. So if you're on prescription meds, talk to your doctor. Estroven Complete. So I think estroven is a combination of black cohosh with something else. Let's see. And thank you for the likes. We're up to 10,000. That is amazing. So again, if you have questions, drop them in the Q&A button down below. You're eating clean, exercising like crazy, and no weight loss. Okay, this is the number one thing that I hear from patients, besides hot flashes, is that body composition changes, unexplained weight gain, and that you're gaining weight in places. When I say body composition change, I mean you're gaining weight in places where you never have before. And so that is probably due to increasing inflammation levels related to perimenopause. And so you have got to change your nutrition. Even though you think you're eating clean, guys, if you're not tracking what you eat and you are not following your nutrients, this is my number one premise. I have multiple blogs on our website about this. I have hundreds of TikToks. I have full YouTube videos explaining this in great detail. If you are looking for something different, something new, where you're not counting calories, because I'm telling you, for most of you, counting calories is no longer going to work the way it used to, take a look at the Galveston diet. Take a look at our free meal plans. Take our inflammation quiz. If you think you are out there eating clean, eating healthy, and you're gaining weight and you can't understand why, number one, you need a thyroid test to make sure you don't have undiagnosed hypothyroidism. Number two, you should consider, changing some basic nutritional habits and making sure you understand what your nutrients are. Thank you guys for the heart. That was so sweet. So we have an inflammation quiz. It's a validated scoring system. And it's on our website. So if you go up here to Dr. Mary Claire, you go to the top of my TikTok page, there's a link in bio. We have tons of free resources there available for you to learn more about. If you think you're perimenopausal but you're not sure, I have a validated scoring system for that as well. If you're looking for a good menopause provider in your area, we are compiling a database based on my followers' recommendation. We have hundreds there. So hopefully there's one close to you that, I verify that they are physicians still practicing, not that they're great doctors, but there are personal testimonials, or they are North American Menopause Society certified. So all of those resources are available to you at Dr. Mary Claire, the top of my TikTok page, or at our website, galvestondiet.com. Okay, do I feel weight loss medications are okay to help with weight gain during perimenopause? Nope. The Galveston diet and what I do and teach is not quick weight loss, okay? If you want to look good for a date or a reunion or a wedding, go take some diet pills. I'm telling you, an appetite suppressant is never going to be the answer for you to be healthy for the rest of your life. The Galveston diet is more about you being a functional, strong human being as you age, okay? Yes, you will probably lose weight if you've had, a sudden weight gain. But more than that, you're going to be healthier. You're going to sleep better. You're going to be more functional. Your brain is going to work better. You're going to be stronger as you age, okay? I don't want to live forever. I know that's not going to happen. But as I age, I want my old lady body. And here's my old lady body. I want to have dense bones, strong muscles. I want to have a mind that still works like a tank. I want to be able to climb mountains, throw grandbabies in the air. I don't have any yet. Okay, no pressure to my children, but this is what the Galveston diet is about, is helping you get through this phase of your life as healthy as possible so that you can age well. You can be well as you get older and not dysfunctional. So if you're looking for diet pills or quick weight loss answers, I am not your girl. I am not the one who's going to be able to help you with that. There's plenty of people out there, these quick weight loss centers, who are willing to do that. I am here to teach you good nutritional principles, health concepts, teach you about menopause, teach you about your body, help you be as healthy as possible as you age so that you remain functional. I am here in Kenya at 53, okay, there are a lot of old people here, and some of them are kicking fucking ass. They are like in and out of these trucks, on these safaris, jet lagged, killing it. I want to be them. I want to be like that, and actually it's a lot cheaper than you think. It is not like, we fly for free because my husband works in Kazakhstan and we have like literally a million miles, not kidding. And so getting here, once you can get here, Kenya is not expensive. I mean, not as much as you think. It's very reasonable. So anyway, so no, I do not think that weight loss medications are the way. Struggling with weight, fat distribution, need a new wardrobe. Okay, listen, go to galvestondiet.com. Go check out what we have. I'm telling you, I can absolutely help you here. You don't even have to pay for the program. We have tons of blogs, YouTube videos, sample meal plans. Go and see if you feel like this is a good fit for you. But the greatest thing is our community of like-minded women who are all focused on the same thing. I love it when I'm in clinic and my patients come in and they're like, look, I know that I'm not going to be a size 2, okay? And they said, but I don't want to be my mom. I'm looking at my future and like the path that I'm on, and if I continue on this path, I'm not going to be functional. I'm not going to sleep well. I'm not going to be healthy. I'm not going to be well. I'm not going to feel good, and I don't want that. And so we work on a plan together. Exercise, nutrition, medications if they need it, supplements, everything we can do to package this together so they can be a functional human being as they get older and enjoy their life and their families. Okay, gain 35 pounds in 2 years, no period for 2 months, help, welcome to perimenopause, or menopause, no period. And so again, most likely this is related to perimenopause, but you do need some blood work to rule out some other causes to make sure we're not missing anything. Is a small dose of estrogen safe? Yes. Estrogen and hormone replacement therapy doses is considered to be very safe. The women who choose HRT versus those who don't, okay? Every single one of you deserves a conversation. You may choose not to get it. That is your right. That is your choice, and I fully support it. But here's what your doctor's not telling you. The all-cause mortality for a woman who chooses HRT, meaning any chance of death for any reason, is lower. The all-cause mortality due to heart disease is lower if you choose HRT. The all-cause mortality due to death, due to cancer, is lower if you choose HRT. Very slight increased risk of breast cancer. The same as being obese. The same as drinking wine every night. Okay, if you choose HRT and you have to take progesterone with it. If it's estrogen alone, if you don't have a uterus, no increased risk of breast cancer over baseline. Your doctors aren't telling you this because they haven't kept up with the latest research. This is the God's honest truth. This is what's happening. So everyone, double tap the screen to like this video. Please, please, please help me keep me relevant. And you can share this video with you think right here. And if you don't follow me, my name is Dr. Mary Claire Haver. I'm a board certified obstetrician gynecologist. I am a menopause warrior. I'm the founder of the Galveston Diet. I'm also certified in culinary medicine, so I am a medical nutritionist. Okay, let's see. I'm reading the questions. So remember, you can lightning Q&A. All right, here we go. What's the best restaurant I've been to? Let's stick to menopause questions, guys. Drop your questions in the Q&A button. That's so funny. Is 44 too young to start perimenopause? No. Have all the symptoms, period 35 days apart. No, that is not too young. Now, if you've lost 25 kilograms, not on purpose, meaning you didn't change your diet and exercise, you need to see a doctor immediately. There is something not okay, and you should never lose that much weight. And you guys, thank you so much for the likes. We're almost up to 20,000. I so appreciate it. But no, remember, the average age of menopause is 51, and then meaning your period stops, okay? But normal still 45 to 55. Perimenopause starts 7 to 10 years before that. So between 35 and 45 is when your perimenopause is going to begin. It's going to begin. You're going to start feeling the symptoms. HRT, I'm sorry, for you guys from other countries, bird, okay? Probably about 90% of women can safely take HRT with very little increased risk, and their overall health risk is going to be so much better. Do I think every woman should be on it? I think most women should be on it. I think every single woman should have a legitimate conversation about it and be offered it. So I had a woman reach out to me today who said, my doctor said I can't take it because I have hypertension. I'm like, hypertension is not a contraindication to hormone therapy. It's not. It is not. Okay. Let's see. Q&A in the Q&A box. Where? I'm not finding it right now. More. Okay. So, no libido and had a missed period. Wait, hang on. Diagnosed with breast cancer, and they pushed me into medical menopause. Anything without estrogen you can take to help. So when you cannot take estrogen for that reason, that's a completely legitimate reason if you have estrogen receptive positive breast cancer or progesterone receptor positive breast cancer, that we treat your symptoms. So you need something to keep your bones strong, something to stop hot flashes, something, you're not going to have as much symptom relief as other women who can take estrogen, but there are definitely things that you can take safely, but nothing is going to work better than estrogen, but we do have options for you. But we take it symptom by symptom. Let's see. I'm 42. You had a full hysterectomy, 2 years due to endometriosis carcinoma. Your gyno refused to give you HRT. Find a new gynecologist immediately. You had endometrial cancer. So you need to talk to a new doctor. There's definitely some women in your condition, if I'm understanding it correctly, where some hormone therapy can be an option, but you need to talk to your doctor. I cannot give you direct medical advice on TikTok. So 35, partial hysterectomy, what should you do to prepare for menopause? Educate yourself as much as possible. I have hundreds of videos about perimenopause, its symptoms, what to expect. And so I would read as much as possible. Go watch all my videos about perimenopause or other people's videos who are out there talking about it. Not many people. Remember I would change your diet and exercise habits now. Act like you're in menopause now, okay? And then start talking to your doctor now about hormone replacement therapy, when you should start, support during perimenopause, and what you can do about it. I am not referring to pellets, guys. When I talk about hormone replacement therapy, it is all forms. Pellets are just another form, and they're not regulated by the FDA. They're not safer, they're not better, they're not whatever. People are making a lot of money off of you selling you pellets. I'm not saying pellets are bad. If you're doing well with pellet therapy, that's fine. But remember, you have other options that are a lot less expensive. You can find hormone therapy for $20 a month in the US. $20 a month, okay? So you do not have to mortgage your children or not go on vacation because your doctor is trying to convince you to buy the pellets that they are making a fucking fortune off of. Let's see. Is there an age where you can't start HRT? You're 59 years old. It's going to be difficult for you to find a physician who's willing to give you a trial of hormone therapy at 59 if you've never been on it. We don't have a lot of data to support its use starting new at 59. But again, no one's paying for those studies. So full hysterectomy at 38, you took nothing. 48 now, should you be taking anything now? I would absolutely, because you are at such higher risk for heart disease, cancer, osteoporosis. I mean, it's incredible. Like, someone should have sat you down and said, listen, going through menopause at 38, surgical menopause, puts you at much higher risk for disease, long-term disease, and causes of death, and cancer, all the things. So yes, absolutely, I would start immediately. To decrease those risks. So what hormone therapy do I recommend? Everybody asks me that. I talk to the patient. It depends on her budget, on her lifestyle, on her risk factors. I mean, the cheapest thing is the pills, oral, but it does slightly increase your risk of blood clots. So transdermal is considered to be safer. Like in the UK, they just do transdermal. Or mucosal, transmucosal, like the vaginal ring. And so that takes the risk of blood clots away. So, however, if my patient can, those are more expensive. So I just have a frank discussion, look at our budget. I pull up GoodRx, my favorite app for helping a patient find affordable hormone therapy. I do a patch. That's my favorite because I am lazy. We travel a lot. I can't remember to do something every day. So the patch is just easy. I just slap it on there. It's transdermal. I don't have to worry about blood clots. And it works really well for me. So yes, I'm in Kenya. Take me with you. It's incredible. Oh my God. Okay. Y'all want to come? You want to see what Kenya looks like? Okay. So I'm at our hotel. We are going to leave for a game drive, but we are on the Mara River, and this place is gorgeous. And there's monkeys. We've seen elephants and lions. If you go to my Instagram, I have tons of pictures on Insta of all the animals that we've seen. Let's see, elephants, lions, cheetahs, antelope, buffalo, the Kenyan buffalo. It's been awesome. The elephants are incredible. We saw little baby elephants, like so cute. So yeah, Kenya's amazing. Okay. I'm taking progesterone only right now. It's been so much better than before. Great. Some women do really well on progesterone only therapy. Some people choose to do that during perimenopause. Some doctors are great at prescribing that. No, I'm not on a bus. We do these game drives in these open air kind of trucks and with seats in the back. And we literally were 15 feet from lions, just walking around like in the wild. It was pretty exhilarating. Okay, so 43 went through super early, 33 increased risk in cancer being on HRT so long. No, not over baseline. Your risk of all-cause death from cancer is higher if you don't stay on HRT. Can you stop and restart HRT? You can do whatever you want. You're an adult. I wouldn't. But you can. So is HRT birth control? So a lot of physicians, myself included, will use birth control pills as hormone therapy in perimenopause. One, it helps control the fluctuations better. It suppresses ovulation better, and it just gives you a more steady state. So I do use that quite a bit in perimenopause. You're 42. Let's see. Loved your podcast with Heather Hirsch. Aw, she's a doc in Boston. She was awesome. I'm so glad you got to see it. I'm like on podcast crazy. I just was on Shalene Johnson. So this is so crazy. She reached out to me. Oh my God, I want you to come on my podcast. I've worked out with that woman for 20 years. on Beachbody. And this woman reached out to me. I thought I was going to die. She's so nice. We did this whole podcast together, and she just published it. So if you go to the Chalene show, Chalene Johnson, it was like the coolest thing for me. I've also, Jessie T and Heather Hirsch, I've like 3 podcasts coming out where I've been guests. So it's just been really exciting to talk more about menopause and share my message. Let's see, 45 in full menopause. What do you need, supplements or meds? What are the risks of taking nothing? The risks of taking nothing are that you die sooner than you would have without taking something. The risks of taking nothing are that you get cancer sooner than you would have without taking something. The risk of taking nothing are that you will have heart disease sooner than you would have had you taken nothing. So those are the absolute statistics in the general population. Now, it varies from person to person. We all have unique genetics and how we react, but I am staying on HRT probably until I die. Now, that's my personal choice. I have tons of heart disease and cancer in my family. I'm trying to fight it as much as possible. So supplements or meds. So remember, supplements are just supplements to supplement a healthy diet. It's not medicine. And so, I take magnesium and it helps with sleep. I take fiber and I take collagen. I'm also on hormone therapy. I read the book from David Sinclair on aging, and so I'm now taking NAD and resveratrol, resveratrol is what is in the skin of the grape, which it has anti-inflammatory effects on the heart. It's kind of an experiment. I'll show you. I actually need to finish taking my supplements for the day. So yeah, I travel with them. Here's my little pill pack. I also take omega-3 and vitamin D. I do sell some of the supplements. If you want to go check them out on our website, you can. Let's see, 57 new messages. I'm trying. I'm gonna have to leave in a minute to go get ready for safari. But my Instagram, so if you go to Dr. Mary Claire up here, and you can click on the little Instagram picture, it'll take you to my Insta. I have tons of pictures from our trip here to Kenya, and I highly recommend it. It's much more reasonable than you think. All inclusive, this place that takes you on the game drives, feeds you incredible food, the most knowledgeable and lovely, and they're all like certified safari guides. They know everything about the flora, the fauna, the animals, the history, the local people. We got to go to a village and meet the chief, and the warriors dance for us. I mean, like, incredible. The price is way better than you can think. These are the supplements I take. The only prescription I use on a regular basis is my hormone therapy. I have Celebrex and a couple of other things I take as needed. 47 major cancer, reproductive organs, family history. Is it safe for you to take? More than likely, but talk to your doctor. You deserve the conversation about this. And if you're looking for a menopause-friendly provider, we have a list that my followers have compiled about awesome menopause doctors in their area. It's at the top of the link. So, yes, menopause absolutely can aggravate any inflammatory condition, muscle, nerves, joint pain, headaches, migraines. All of it can get worse in menopause. The name of the book is called Lifespan, Why We Age and Why We Don't, by David Sinclair. Lifespan, someone type it out, Why We Age and Why We Don't. It's fascinating. It's very cerebral. It's very, very sciencey, but it is awesome. So, let's see. Your mom took HRT and had a heart attack. Guys, and the doctor said it's because she was on hormone therapy. There is no data. I'm sorry that happened to your mom. I'm so sorry. But your doctor's wrong. Okay, your mother had pre-existing cardiovascular disease that was undiagnosed. And HT, one of the contraindications to hormone therapy is pre-existing cardiovascular disease. Okay? Meaning you have damaged arteries. You should not be taking it. So your poor mother probably had, that was probably there for a while, and HT exacerbated it. So before you start HT, your doctor needs to determine if you have pre-existing cardiovascular disease, which is our job as doctors. So, okay, I need to go and get ready for our game drive in Safari. Check me out on Instagram. Everybody double tap the screen real quick to like the video. Just tap on my face like this, tap, 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 tap. And that gives me some likes. It helps me stay relevant on the platform. It was so great answering your questions. Let's see. Okay, and everyone have a great day, and follow me on Instagram. I'll be posting lots of pictures from our safari today, so you guys can come along with me, because I know it's a big journey for a lot of you. It's 30 fucking hours to get here.